We want to start with Moderna's vaccine, which is being considered for approval today. How could that impact this first phase of vaccinations? Do we actually need those vaccines immediately?
We actually do, if you want to keep on to the schedule of which we'd like to do. We're trying to get 40,000 doses for 20,000 people before the end of December. So if the Moderna product gets the EUA and starts implementing the vaccine administration program, that would be right the way we wanted to plan it and the way we did plan it.
When do you expect the vast majority of the general public, younger, healthier people, to start getting vaccinated?
Not necessarily exactly, but somewhere around March, April, when people who were, we say, in the general population can start getting vaccinated in earnest. And I would hope that we would get such an enthusiastic uptake of the vaccine that within a period of 3 or 4 months, we might be able to essentially get the overwhelming majority of the population vaccinated, so that as we enter into the late summer and early fall, we could really be in a situation where we could start approaching some degree of normality. But it's going to depend on the uptake of the vaccine by people. That's the reason why we're out there encouraging people to receive and accept the vaccine.
Once those vaccines are widely available, will it be safe to have large gatherings if everyone is vaccinated?
Well, if you get an umbrella of herd immunity over the country where, we don't know what that number is. It's somewhere in the range of 70 to 85%. We don't know at this point what that is, but somewhere at that higher level, that I believe that we can start to approaching a degree of normality. And to me, that would mean what you're referring to. That would mean really children safely back in school, being able to go to a theater, being able to go to indoor dining.
When do you expect the vaccine will actually make a noticeable difference in seeing a decline in cases?
I think when we get a fair percentage, I would say between 30 and 50% of the population vaccinated, that you're going to see a change in the dynamics.
Are you thinking January, February for that?
Probably closer to March, April.
I've heard people say the vaccine, it's a personal choice. I'm not comfortable with it. If somebody else wants to take it, that's fine, but it's not for me. What do you think of that mindset? Are you okay with that?
Not completely. I can understand why people might want to say that, but I think what they need to rethink is that a vaccine program is good not only for you and your family to protect you from infection and disease, but it's also part of the societal effort to essentially end the epidemic. And the more people that get vaccinated, the closer you get to truly ending this pandemic. So there's a bit of a societal responsibility in there. You want to get vaccinated for your own self-protection, but you also want to get the level of vaccinees so high that you really will get herd immunity.